50 million. 50 million people. That's how many people died in the Spanish flu of 1918 and 1919. And that was a pandemic that came in the years that followed on from World War I and the death and destruction that was associated with that. They were horrible, miserable years. Yet in the years that followed, the United States boomed. National wealth more than doubled. Millions of Americans were propelled into prosperity that they'd previously only dreamed of. For the United States, the crisis of the Spanish flu became an opportunity. We've been living through an incredible crisis too. Since 2020, many of us have lost loved ones, we've faced financial difficulties, we've struggled with our mental health. Some of us, like me, have been locked up at home for months with small children, struggling with the challenges of remote work at our kitchen tables. That was tough. But what if we could ensure that the next decade was one of prosperity rather than stagnation? What if of joy rather than depression? What if we could take this current crisis and turn it into an opportunity? What if we could tap the insights of past crises and ensure that we've got all those insights ready to take us forward? I work in public policy and economics. I head up economic development and international engagement for the Australian city of Melbourne. For the past couple of years, I've been helping to shape the city's response to the economic impacts of the pandemic. How do you recover from a pandemic? I'm not sure any of us really know the answer to that one. It's a huge question. The best way I could think of to answer that question was to go back and examine past crises from the past century, looking at pandemics, wars, natural disasters, recessions, and seeing if there were transferable insights that we could use to apply. When I did that, I discovered that there were countless examples of places and cities and countries that had faced a very serious challenge and gone on to create a future that was better and brighter than ever before. And when I looked closely, it became apparent that successful recovery shared three key factors. I wonder if you can guess what they are. The first is a preparedness to learn from the experience of the crisis. Crises are horrible, intense things, but they teach us a lot about our institutions and our systems and ourselves. 20 years before COVID-19, the world was facing another public health challenge. Severe acute respiratory syndrome, or SARS, was like COVID-19, was a coronavirus that caused shortness of breath. And in 2002 and 2003, it was sweeping throughout much of East Asia. Taiwan is a highly developed East Asian economy with a fantastic public health system, arguably one of the best in the world. And at first, Taiwan faced only a few cases of SARS. The virus looked to be manageable. But then, cases started breaking out, and the number of cases grew exponentially. It was triggered by mass outbreaks in hospitals. 1 in every 4 people who caught the virus died. Ultimately, Taiwan went on to have the worst fatality rate from SARS in the world. So after the crisis, the government of Taiwan was determined to learn from the experience. They sent the health minister and senior officials off to the United States to learn, with a view to radically improving preparedness for future pandemics. When they came back, they established a pandemic control centre, like a war room, to better coordinate future pandemic responses. They introduced a raft of legal measures to better support interventions such as compulsory detention and quarantine. And they invested hundreds of millions of dollars into the healthcare system, constructing isolation wards for future outbreaks of infectious diseases, and investing in an enormous national stockpile of medical products such as masks. So when COVID-19 arrived, they were ready. And since the start of the pandemic, Taiwan has experienced very, very few deaths. Life in Taiwan has largely been able to carry on as normal. Taiwan's gone from having the worst fatality rate during SARS to amongst the world's best during COVID-19. And so for Taiwan, the crisis of SARS ultimately ended up being an opportunity. After a crisis, it's often really useful to systematically go about the process of learning from the experience. A public inquiry is often one way of doing that. And just like in Taiwan, it'll be really important that after COVID-19, we systematically think about how we can learn from our experience. The second intervention, or the second theme that's common to successful recoveries is a preparedness to work together. Many, many people are involved in recovery. It's complex, and setting up systems that enable us to work together is critical. Dr. Kunturo Mangkusubroto is the former head of the agency responsible for reconstruction in the Indonesian province of Aceh following the tsunamis of 2004. I spoke to him recently. I wanted to understand the largest ever humanitarian recovery operation. He's now in his mid-70s, he's a super impressive person. He projects humility and strength. But back in 2005, when he was in Aceh, he was overwhelmed. Everywhere he looked, he saw devastation. Within 2 to 3 kilometres of the shoreline, every single house was swept away or destroyed. In the capital of Banda Aceh, 167,000 people had died. He was faced with quite an impossible question, really. How do you respond to devastation like that? Where do you even begin? But luckily, although he was overwhelmed, he was not alone. Billions and billions of dollars of aid money had begun to flood into the country. People had seen the crisis on their TVs and wanted to help. Hundreds and hundreds of enthusiastic aid workers had begun to arrive. Many of them were working, though, for aid agencies that had no previous involvement in Aceh. There was lots going on. It was quite complex. Lots of potential for things to go wrong. So Mangkusubroto and his team determined some key principles. Firstly, the recovery would be led by the community. Communities themselves would be supported to develop plans for the reconstruction of their villages, and no construction would happen until they signed off on those plans. Also, organisations from government, from the aid sector, and from major donors all worked together under a single master plan. They came together and determined together how the money would be spent. Ultimately, although the recovery in Aceh has not been perfect, life in Aceh now is unquestionably better than it was before the tsunami. There's been enormous reconstruction, major new infrastructure, trust levels are increasing, and poverty is lower than it was before the tsunami. For Aceh, ultimately, a terrible, terrible tragedy in the tsunami ultimately ended up becoming an opportunity. Working together after a crisis is absolutely essential. They're complex, they involve many, many people. Establishing a mechanism that enables people to work together is a really important thing to do after a crisis. And just as it was in Aceh, as we contemplate our recovery from COVID-19, it'll be important we think about mechanisms to bring all the people together to work on that. From not-for-profits, government agencies, service providers, we all need to come together. Finally, the third element common to places that recover successfully from crises is a preparedness to look forward, not go back to the way things were before the crisis. Back in after the Spanish flu of 1918 and 1919, many countries sought to go back to 1913, the way things were before the Spanish flu and before World War I. But the United States was looking forward. It was embracing technology, such as the internal combustion engine, rolling out mass electrification throughout the country, investing in science and technology. And that forward-looking mindset set the country up for a decade of growth. The Roaring '20s led to improved life expectancy, greater involvement of women in the workplace and in politics, the rise of consumer culture. Nearly a century after the Roaring '20s, another place that was looking forward, not backwards, was New York City. New York is the world centre of the finance sector, and it was devastated by the global financial crisis. At the peak of the crisis, more than 400,000 people were unemployed. I spoke with Bob Lieber. He is the former deputy mayor of New York City, and he was the man responsible for leading the city's economic recovery. And he tells me that New York City, after the crisis, they determined that New York City was overly reliant on the financial services sector. So rather than seek to go back to the way things were before the financial crisis, Lieber and his team sought to support the emergence of new sectors that would be critical for the future economy of New York City. Sectors such as biotechnology and tourism and fashion and tech and all sorts of things such as that. They did such things such as establish a world-class graduate school of engineering on the Roosevelt Island in the middle of the East River. Working with a private real estate firm, They built a new bioscience centre on land owned by the city. They established a new investment fund for fashion. And in the decade that followed the financial crisis, New York City's economy diversified. 700,000 new jobs were created, the largest and longest expansion since World War II. By looking forward, not seeking to go back, New York City's crisis ultimately became an opportunity. And so, after a crisis, it's really tempting often to focus immediately what's in front of us, on the short term. But it's critical also that we look forward to the medium to longer term and we plan the future that we want to create for ourselves. So, as we think about our recovery from our crisis, there are three things we need to bear in mind. We need to learn from the experiences of COVID-19, we need to work together, and we need to look forward, not go back to the way things were before the pandemic. There's no shortage of countries or places that have adopted this approach and gone on to thrive, becoming healthier and more prosperous than ever before. This is an approach that applies to national governments, it applies to cities, but it also applies to local communities. Learning, working together, looking forward. These are things we can all do in our local communities too. So when people ask me now, how do I feel about my work in Melbourne? I answer that I feel optimistic. We can all be confident that if we adopt an approach like this, we can build a better future. The future is us, and we can realise the opportunity of this crisis.